So, the short answer again would be Google. But the reality is that there is a lot of information out there which is incorrect. There's a lot of information which is confusing and misleading, and a lot of inflammatory information out there talking about, systems, failures, etc. At the Chester convention in Austin, we had the keynote speaker, Mr. Heath, who mentioned that many failures lead to a success. So there have been failures, definitely, in the care for Ebola, but I think those are all lessons that we are learning. So from that standpoint, I think if you look at the resources I would turn to, it would be the official ones. I would turn to the WHO, I would turn to the NIH, the CDC, and definitely the universities which have actually had Ebola patients in the US, say Emory, Nebraska. So I would look at those as good sources of information to turn to. In addition, I think there has been some degree of research which Doctors Without Borders has done over the years. There's been a number of similar epidemics of Ebola over the years in Africa. So we can learn from all of those. New England Journal of Medicine has had a recent series of articles which are freely accessible. So these are all simple places you can go to. Ultimately, if you have a resource, someone who's actually been there and done it, they would be a good person to talk to about practical applications of how you would use the personal protective equipment, the emotional needs of the healthcare providers before you go there, after you get back, and the current ongoing questions about quarantine. So these would all be issues you can talk to in person to people who have actually been there.